This is the changing face of medicine in the United States and Canada. So is this. The rate of change in the healthcare profession is constantly accelerating. It can sometimes leave you feeling alone and unprotected. In this environment, who'll give you unlimited support? Who's got your back? With more and more specialties being created, the question arises, who is going to certify these physicians and recognize their achievements? For various reasons, certain managed care organizations, hospitals, state medical boards, and other healthcare organizations will unfairly discriminate against deserving physicians. But there is one certifying organization, the American Board of Physician Specialties, the ABPS, that long ago recognized that the changing world of medicine is dynamically enhanced by inclusiveness.
ABPS has been around since 1950. Really, it's an organization that is now 60 years old. It has a rigorous process, scientifically sound, very credible, and indeed, it's a process in which I believe both health professionals and the public can have great confidence.
The American Association of Physician Specialists was organized in 1950 by surgeons. 2 years after, it was incorporated. The American Board of Physician Specialties is the official certifying body of the umbrella organization. We readily accept both allopathic and osteopathic physicians. We are the first board in the United States to accept public members, providing them with full voting rights and privileges.
I like that big tent approach to medicine. I think we all have different gifts, different things to offer, and I want an organization that recognizes both camps.
Came to one meeting. I walked away saying, this is the first time in organized medicine that I have had the opportunity to meet like-minded people who really still care about the patient. Not about reimbursement, coding. They care still about doing the right thing for the patient.
So what are some of these emerging healthcare areas? ABPS currently certifies and recertifies physicians in 16 specialties. From disaster medicine to family practice, emergency medicine to hospital medicine. We provide a myriad of opportunities for all physicians.
ABPS definitely is on the cutting edge. We've started the Board of Disaster Medicine. There's no other board like it in the world. We are the first board to have used high-fidelity simulation as part of our oral examination process.
Coroners and medical examiners, by definition, are going to be involved in every single disaster situation in which there is one fatality or thousands of fatalities.
The things that impress me most about this organization are, number one, their concern for their physicians. It is an organization who has tremendous interactive connectedness. They give such attention to the development of their professional credentialing. They're in the process of ever improving and ever qualifying physicians to be on the cutting edge of their specialty.
All right, we've established that ABPS is innovative and welcoming. All of our exams have been reviewed by an independent psychometrician and have been consistently documented as valid, reliable, and psychometrically sound. Our written and oral examinations are consistent with testing standards of the American Educational Research Association and the American Psychological Association. Let's just say that when our doctors are tested by us, they know they've been tested.
This organization spends a lot of time and money to make sure that psychometrically the examinations are sound, but more importantly, look at the rigorous process.
We have one of the hardest examinations, written examinations, in medicine, but it tests material that people have to know to be deployment-ready physicians.
The practice of medicine can be a lonely one. Sometimes you wonder why you got into it in the first place. So while physicians seek certification to help their careers and have their hard work and dedication recognized, many are hungry for something more.
During my first 3 years of practice, I felt I was alone. I was an island. But now I felt I have a network of good people for resources and a network of very good professional colleagues.
It's an organization that is very member-oriented. It's not so big that I'm a number. I see the same people meeting after meeting. They're my friends.
The thing that impresses me the most about the organization is their attention to detail, a sense of really wanting to work with their membership, help their members with certification issues, with recognition issues at all. Being very easy to deal with an office staff. They're very responsive to us as physicians. We really work well as a team.
Good afternoon, ABPS.
You're not a mere number in ABPS. They don't just take your fees and say, "See you around." Instead, you're a valued participant whose voice is heard and respected. Perhaps that's the reason when members talk about ABPS, a feeling of pride quickly becomes evident.
I went with ABPS and they certified me, and it has been a wonderful experience for me because now I can go to anybody and say, here I am and I'm qualified and I'm competent to take care of you and your family.
By virtue of becoming certified through ABPS, I've been able to move ahead and become Assistant Director of Emergency Medicine, and now I'm Chairman of Emergency Medicine in New York.
ABPS is also different by recognizing the fact that physicians who become board certified need to become recertified, and as part of that process, one unique area is the fact that we require a non-remedial medical ethics course for each diplomat every 8 years.
The board certification process of ABPS connects to the well-being of the public by ensuring that we have well-trained professionals who can respond appropriately to various medical issues. The board actually works to see that the quality of care received by Americans is indeed scientifically sound as well as sensitive to the needs of the community.
I've worked for, with, and by physicians all over the United States in the last 3 decades. ABPS diplomats are some of the finest physicians that I have had the opportunity of working with in over 30 years in various capacities.
That's the straight talk on the American Board of Physician Specialties, the ABPS. Joining is a very smart decision for your professional growth, your community, and your family. Change is always going to be with us, so the cutting edge is the only place to be. Contact the ABPS now.